And so following on from that, Lynn, people say, well, you're just anti-doctor, what doctors don't tell you. But, it's not quite as simple as that. I mean, we're not anti-doctors per se. We think they're very super smart, super caring, super wonderful human beings who probably give more time than almost anybody in the care of others. Our complaint is about the tools they've been given and the fact they are only given drugs to deal with patients, and they're not seeing patients getting better. And, it isn't surprising that we see the rates of early retirement, even suicide, are higher amongst doctors than any other profession. And I think there is a special reason for that.
Absolutely. They went into medicine to cure people, and they're not curing people. It must be incredibly frustrating. The whole model with drugs and surgery. Surgery is slightly better. It can do things like amazing things like hip replacements, etc. It can be heroic, wonderful, cure or treatment. But a lot of times it also causes all kinds of problems. People die on the table. People have untoward reactions. And so once again, those very extreme tools that can do a lot of harm are all they've got in their toolkit. And that's their issue and frustration.
And I think another argument they say is, well, yes, okay, we accept the limitations of what we have, but, there's no evidence that anything else actually works. And this is where What Doctors comes in and takes real issue with that, because there's always plenty that's going on. And I think what is really interesting is that there's an enormous schism between what is being researched in terms of healthcare and what is being practiced. There are many top institutions from Cambridge, Oxford, Harvard, you name it, who are researching nutraceuticals, nutritional approaches, which are working better than drugs. But the doctors never get to practice this. And that's really the issue. And we've got a few points on that one. For example, quite recently, the Children's Hospital of Philadelphia came up with a report that showed that antioxidant supplements, and especially vitamin E, can combat mitochondrial disease. The mitochondria is the powerhouse of the cell, and it's a genetic disorder, and it's linked to ME, chronic fatigue, diabetes, bipolar, schizophrenia, Alzheimer's and Parkinson's, which isn't really surprising when you think the powerhouse of the cell is being affected. But vitamin E especially, and antioxidants in general, are actually combating this problem. And they've done some proper research into this. It's been tested, and they've found that it is working very well. And it's also helping to reduce a thing called oxidative stress, which is an imbalance between the immune system's production of free radicals and its ability to cope with them. And it is this rush of free radicals which is at the heart of many diseases. And but they're finding these vitamins actually are beginning to work. Well, they are working, and they're beginning to discover that they are. And, all sorts of things that are related to the problems, such as muscle weakness, visual problems, hearing problems, heart, liver and kidney diseases, GI problems, gastrointestinal problems, are all being helped by vitamin E in particular. And it's science, guys. It's been researched and it's found it works.
I mean, we're always surprised by how much copious science looks at alternatives and demonstrates that they do work. There's an enormous amount of evidence. We cover it all the time, every month. And it's not just about supplements and so-called integrative type stuff, functional medicine. It's also the whole range, all those alternative things from, the standards like acupuncture and homeopathy to the very outer rim. There is new evidence coming forward all of the time that incredible things work. But one of the frustrations, too, is a PR problem. And for instance, just talking about ME, chronic fatigue, there was a study that was rushed out, which we reported about, that absolutely was manipulated to say that exercise and cognitive therapy are the things that work. And they were clearly not. And the evidence, when looked at again, was demonstrated to be false. So this is another problem we have, which is, by we, I mean all of us have, which is the information we're getting is oftentimes biased, is oftentimes manipulated by either the drug companies or researchers who are pressured or want to come up with a particular conclusion. So that's where we come in. We try to give you the news that other people don't give you. We try to basically break through fake news.
Mm. And here's another piece of research, again, talking about how supplements and nutraceuticals can actually help with disease. Another one here, another supplement called nicotinamide riboside, NR, I'll just stick to NR if you don't mind, actually makes the whole heart system, the cardiovascular system, younger. And they've actually found this out. This actually works with fasting, that fasting can actually kickstart the whole arterial system and makes it younger. But so too does this supplement. And again, it's been scientifically proven to be very beneficial. And this time from the University of Colorado, who found that it actually reverses the physiological signs of aging in our cardiovascular system. And it helps improve blood pressure levels and improves arterial health. So it could be especially helpful for people suffering from mild hypertension, which is high blood pressure. And, you know, again, is yet another example. Here we are. We got, this has been tested on 24 people who are either given a placebo or 500 mg of the NR supplement for twice a day for about 6 weeks. And in that short amount of time, we were seeing enormous reverses. Now, heart disease still is the #1 killer in the West, especially. And here's this supplement that actually is starting to reverse that and reversing signs of aging of the whole arterial and cardiovascular systems.
And here's the thing about heart disease and most of those areas that are so-called degenerative diseases. You know, medicine approaches it from this whole idea of heroic measure. It figures that if you have a big problem like heart disease, you need a big solution. You need to go in there all guns blazing and do, you know, bypass surgery or stick in stents or, you know, angioplasty. You need a whole pile of drugs. And most of the time with heart drugs, they don't just give you one. They give you 2, 3, 4, all of them working in some way, possibly antagonistically. You know, we don't know that they work. There's no real evidence they work so well synergistically. So all of these big things, you know, all guns blazing approach doesn't necessarily, you know, work as well as a simple lifestyle solution. And here you've got perfect evidence, really good solid evidence that something simple like a change of diet, like some other supplements, can completely reverse the situation.
And the Colorado researchers estimate that this simple supplement, the NR supplement, is reducing blood pressure levels by around 10 points. And this alone would translate into a 25% reduction in heart attack risk. And with heart disease, as I say, being the #1 killer, and one of the major reasons why people go and see their doctor in the first place, I mean, that alone would take enormous burden off of our healthcare systems.
That's the big issue too. When you look at, you know, we talked before about the problems of, you know, of all of the money going out for people who have been harmed. And the same thing happens in the UK where we live, where a huge batch of the budget is going toward essentially, you know, providing money and restitution for victims. So if you can replace this with a simple supplement, you take all that burden off of healthcare on both sides of the Atlantic, and in fact around the world.